Today, I'm going to create an updated video on oxalates, especially in the relationship to flushing out oxalates from your kidneys to prevent kidney stones and other forms of crystallization of oxalates, which could show up as maybe a pseudo-gout or some type of inflammatory condition. There's actually quite a few problems related to oxalates. Let me just kind of run through the symptoms that a person could have if they have oxalate dumping or they're absorbing too many oxalates, okay? Of course, kidney stones are number one. The most common form of kidney stone is the calcium oxalate stone. You can also have these oxalates build up in the bone, the skin, the joints, and your blood vessels. And I already mentioned gout before. Gout doesn't necessarily always have to come from uric acid. It could come from the oxalates irritating that joint. You can also have headaches from oxalates, eye pain, urinary pain, genital pain, muscle pain, as well as intestinal pain. So here's the thing. There's a lot of foods with oxalates, okay? I mean, it's in a lot of different plants. It's in fruits. It's not in meats. It's not in dairy, but it's very high in like almonds, peanuts, spinach especially. It's in chocolate, kiwi, strawberries, beets, tea, and bran. But dietary oxalates are not correlated with oxalates in your urine. So in other words, they have not found that just because you consume foods high in oxalates, that you're going to have high oxalates in the urine to develop these problems. There must be some pre-existing damage to either your kidneys, liver, or your metabolism in some way that you're not able to process or deal with these oxalates like you should. And one aspect of that is in your gut. If you have dysbiosis, if you have a lack of certain microbes, especially the lactobacillus microbes, okay, and there's quite a few different ones, you may have a big problem degrading or breaking down oxalates in the intestine, and then they get reabsorbed into the blood and they end up in your kidneys. But you can also have a problem with the kidneys from having diabetes, prediabetes, insulin resistance, years of eating carbohydrates, etc., etc. So if the kidneys or liver is damaged, you may have a problem dealing with oxalates. And many people that go on the ketogenic diet and they start adapting to fat burning and ketones get rid of their problem with oxalates, but not everyone. So I'm going to give you a list of very important things that I think could really help you just by understanding this. Number one, of course, I would limit the foods high in oxalates, especially the almonds, peanuts, chocolate, spinach, the beet tops. But if you do have these foods, if you add some cheese with the calcium, that calcium will bind to the oxalates in the intestines and prevent the absorption into the blood and into the kidneys. So that's one way that you can kind of lower the amount of oxalate damage to the kidneys. Now, soy, which I never recommend consuming, does have a good amount of oxalates, but it also has a lot of phytates, which tend to minimize the effect. But of course, phytates will prevent the absorption of zinc and other minerals, so that gives you a whole set of other problems. Number one thing I would recommend is find a probiotic with a mixture of all the lactobacillus microbes. Those are lactic acid bacteria that actually help produce oxalates. But the next thing that's very, very important is maintaining higher levels of magnesium, okay, and citrates. Both of those are really, really important in weakening the bond between calcium and the oxalates. But I think magnesium does it in a bigger way. I just released a video on magnesium, and I talked about what foods are high in magnesium. But if you really look at what it's going to take to get your magnesium from foods, you're going to find out it's not as easy as you might think. So I will put that link down below. It's a very important video. So you may want to take a magnesium glycinate supplement to help lower the risk of oxalates ending up in your kidneys. The other thing with the citrates is I would make sure that I would consume like maybe a lemon a day or lemon juice, put some water in there, maybe a couple drops of stevia, electrolyte powder, and I'll blend the entire lemon with water and drink that down. Other times I don't have lemon, so I'll just put some lemon juice in my apple cider vinegar drink and I'll drink that down. But the citrates are very, very important. Now, the other really important thing is vitamin D. Vitamin D increases the absorption of calcium by 20 times in the intestines, which is going to help you take that calcium, make it more available to be able to bind with the oxalates in the gut so it doesn't end up in the kidney as well. Now, I just want to mention a problem that a lot of people have with vitamin D. I did some DNA testing. I think it might have been 20 some odd people I tested with the DNA. And every single one of them had a problem with vitamin D genetically, whether that's converting vitamin D or absorption of vitamin D or the vitamin D receptor. 100% of those people had a problem genetically. And the name for that is a vitamin D polymorphism, which is a genetic issue dealing with vitamin D. And a vitamin D receptor polymorphism is a bioindicator of calcium oxalate stones, which is interesting. So in other words, there's a very high correlation between people that have stones and have a problem with vitamin D, probably because of the calcium absorption problem. So in addition to taking the probiotic with the lactic acid bacteria, lactobacillus, and the magnesium and the lemons, I would also recommend vitamin D, probably at least 10,000 IUs every single day. And then on top of all that, I would recommend consuming minimally 2.5 liters of fluid every single day, just to keep your urine diluted enough so you don't have any type of super concentration or consolidating effect of that calcium binding with that oxalate. If you keep your urine diluted, then you won't get a kidney stone. Now, because of the censoring and the suppressing of the algorithms on YouTube, it's becoming more difficult to find my content. And there's a lot of content that I cannot put on YouTube, unfortunately. So to make sure you have full access of all my information, go to drberg.com and subscribe to my newsletter by clicking the link down below in the description. I will see you on the other side. Now, since magnesium is so important for so many things, if you have not seen my video related to magnesium and getting it from foods, you should probably check it out. I put it up right here.